Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily, and this episode will be diving into a practice question involving vestibular pathologies. All right, warriors, here's the question. A clinician is evaluating a patient who reports vertigo that began suddenly. The patient reports nausea and vomiting, difficulty walking, as well as diplopia. During testing, the therapist notes vertical nystagmus that does not fatigue or suppress with visual fixation. Which of the following is the most likely diagnosis? Is it option A, benign paroxysmal positional vertigo, or BPPV? Is it option B, acute vestibular neuritis? Option C, a cerebellar stroke? Or option D, Meniere's disease? All right, warriors. First, let's break this question down by highlighting the key words in the question. So I want you to think to yourselves, what here would you highlight? What are the biggest things we want to take away from this question? Well, that would be that the patient is having vertigo with sudden onset, nausea, vomiting, difficulty walking, diplopia, which is what? Yep, double vision. And vertical nystagmus, which does not fatigue or suppress with visual fixation. Okay, now that we know the key words, let's break down each option choice to see what the most likely diagnosis is. So option B was benign paroxysmal positional vertigo, or BPPV. This is most common cause of peripheral vertigo. It has a sudden onset, typically brief and positionally triggered, often with torsional and fatigable nystagmus. In this case, the vertical nystagmus, diplopia, and severe balance issues don't really fit this diagnosis, so we can rule this out. Now we have option B, a vestibular neuritis. This is another peripheral condition. It also causes acute onset of vertigo with some nausea and vomiting, but normally associated without hearing loss and without central nervous system signs. But the presence of diplopia and vertical non-fatigable nystagmus suggests that this may be more of a central issue, not peripheral. So although some findings could be present here, we're going to rule this one out because we're not suspecting a peripheral issue. Now, option C, a cerebellar stroke. This looks like a great option choice because a cerebellar stroke causes central vertigo, often associated with vertical or directions changing nystagmus, diplopia, ataxia, difficulty standing or walking. And not just is it associated with that vertical nystagmus, it would also be that non-fatigable and type of nystagmus that will not be able to be suppressed with visual fixation. So here we're thinking maybe central issue. Option C, cerebellar stroke, looks like a great option choice. But let's make sure we need to rule out option D first. So option D, we had Meniere's disease. Meniere's disease is also peripheral and includes vertigo, tinnitus, and fluctuating hearing loss. Now, this presentation does not mention hearing changes, so I think we can rule out option D as well. So option C, cerebellar stroke, was our only central finding, right? Option A of BPPV, option B of vestibular neuritis, and option D of Meniere's disease or are all peripheral in nature, which is another way we can look at this question. So we can rule out options A, B, and D, which leaves us with option D, our cerebellar stroke. Since we are thinking central causes, that is the correct answer choice. So here's a little clinical pearl for you. If nystagmus is vertical, doesn't fatigue, and isn't inhibited by fixation, we're going to think central. Also, if your patient is having neurological symptoms such as diplopia, dysarthria, or severe ataxia, those are also red flags for a potential central lesion. If we're thinking central lesions, we would want to refer out for further diagnostic testing or consultation with a medical provider, especially if they were not already diagnosed with a central lesion. I hope you found this episode helpful, diving into a practice question regarding some vestibular pathologies. Here's a quote from Robert Collier. Success is the sum of small efforts repeated day in and day out. So keep showing up for yourselves with every study session. You don't have to master it all at once. Just commit to steady progress, and you will be ready when it's your time to shine on the NPTE. Keep fighting, warriors. Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, X, and TikTok. Till next time, have a great day and a powerful tomorrow.